Welcome to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. In this, the second section of Module 4, we will explore integrating tables, graphs, and text in writing up study results. Rules of thumb for study write-ups include: use text to highlight the most important aspects of your study results. Stay away from rote repetition of what is already contained in tables and graphs. Be as thorough as possible in explaining results from statistical and interpretive analyses. And avoid interpretation of your quantitative analysis in the results section of your study. Before we give examples of write-ups, you'll recall that in Module 2, our first clinical question focused on the influence of two variables, sodium intake and physical activity, and how a decrease in one and an increase in the other could lead to changes in patient blood pressure. We will use a prospective study design, and our outcomes will include average daily blood pressure and physical stamina. Our metrics will include systolic and diastolic blood pressure values and average stamina in minutes. This illustrative write-up incorporates one of the tables for Clinical Question 1. The write-up starts by referring to the table. It then reports the statistically significant differences in blood pressure and physical stamina between the two groups. Ending mean systolic and diastolic BP readings were significantly lower for patients with decreased sodium and increased exercise. Ending mean stamina and range of motion for knee flexion were significantly greater for patients with decreased sodium and increased exercise. The write-up concludes by stating that there were no other differences between the groups on the other metrics. This illustrative write-up incorporates one of the graphs for Clinical Question 1. The write-up starts by referring to the graph. It then reports the statistically significant difference in blood pressure between the two groups at several points in time. Mean systolic BP was significantly lower for patients with decreased sodium and increased exercise in months 6, 9, 10, 11, and 12. As before, the write-up concludes by stating that there were no other differences between the groups at the remaining time points. In Module 2, our second clinical question was whether varying exercise types for patients could lead to short and long-term changes in pulmonary function. We will use a case control study design, and our outcomes will include average FEV1 values and average SpO2 values. Our metrics will include average FEV1 values as a percentage of normal capacity and average SpO2 values as a percentage of oxygen saturation. This illustrative write-up incorporates one of the tables from Clinical Question 2. The write-up starts by referring to the table. It then reports statistically significant associations between a progressively challenging exercise regimen and healthy FEV1, and age and healthy FEV1. The write-up concludes by stating that there were no other significant associations between the other predictors and the outcome. This illustrative write-up incorporates one of the graphs for Clinical Question 2. The write-up starts by referring to the graph. It then reports the statistically significant differences in FEV1 and SpO2 between the two groups at several time points. The write-up concludes by stating that there were no other differences between the groups at the remaining time points. In Module 2, our third clinical question focused on caregivers' experiences and collaborations when treating patients with lymphoma. We will use an ethnographic approach with exploratory, open-ended interviews, digitally recorded and later transcribed. The interview guide will be designed by healthcare professionals, scholars, and caregivers. We will then read all transcriptions, develop themes, and produce final categories, with interpretive analysis to be reviewed by scholars to ensure validity. This illustrative write-up incorporates the first table from Clinical Question 3. The write-up starts by referring to the table. It then reports specific caregiver characteristics. Mean age was 62. There were slightly more females than males. The caregivers in this sample were mostly white and Asian. And it was predominantly parents of family caregivers who were affected by lymphoma. This illustrative write-up incorporates part of the second table from Clinical Question 3. As before, the write-up starts by referring to the table. It then reports a portion of one caregiver's simplified response to an item in the interview guide. With regard to emotional consequences, The caregiver stated that working with a lymphoma patient is both challenging and rewarding. The caregiver also stated that he is confident that he will be able to care for his family member and that he has new empathy for those suffering from chronic illness. Finally, displaying categories of quantitative findings and figures can be very effective. For clinical question 3, this is where you could list how many caregivers discussed issues regarding sharing concerns, role definition, and collaboration. Actual quotations given to the investigator by the participant are also listed in the results section of the write-up. An example of a direct quotation from a family member might be, "At first I didn't want to discuss issues with my mom's caregiver, and it was easier to do it myself. But I soon realized that they could help. And sharing my thoughts, ideas, and problems with caregivers made the whole experience more meaningful." In the next module, we will discuss how to operationalize your study, taking into account ethics, funding opportunities, and study oversight. Now we'll ask you to reflect on what you've learned. What is a good way to use text when writing up results from your study? A good way to use text is to expand on the most important aspects of your results, that is, to provide information beyond what is conveyed in tables or graphs. In a quantitative study, what are some items displayed in results tables? Common items include variables used for analysis, sample sizes, and p-values. In a qualitative study, what are some items you could display in figures? Items include categories of findings, for example, results based on responses to questions in an interview guide. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni, in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations, you have completed Module 4.